All right, thank you for staying with us on Fafanua Afrika. Now, we have been talking about youth addiction to drugs and abuse and also the dangers associated with it. Now, substance abuse refers to the harmful or hazardous use of psychoactive substances, which include alcohol and illicit drugs. Now, one of the key impacts of illicit drug use on society is the negative health consequences experienced by its members. A drug use also puts a heavy financial burden on the individuals, the families, and of course the society. The evolution of a complex global illicit drug problem is clearly driven by a range of factors. Our socio-demographic trends are influential, such as the population's gender, their age, and the rate of urbanization. Cannabis remains the most widely used illicit substance in the African region, but that doesn't stop people who cannot afford such drugs from using very ridiculous drugs like we mentioned earlier. And the highest prevalence and increase in use has been reported in West and Central Africa. Amphetamine-type stimulants, the ATS like the ecstasy and methamphetamine, now rank as Africa's second most widely abused drug type. Other substances that were used by children and youth surveyed in Sierra Leone, for example, included benzodiazepine, which like diazepam, chlorpromazine, and all of that, while 3.7% were injecting drugs into their system. Now, injecting drugs can carry a high risk of infection. That is another aspect that we will be looking at. Infections like HIV, blood-borne viruses, hepatitis, and all of that. But anyways, that said, we will be introducing a new set of guests. We have we have both of them with us who will be helping us dissect this issue and talk more about it. Now, if you were with us earlier, you will know that we had Ifeoluwa Yimika and Michelle who helped us to understand some, of the key areas associated with drug abuse. And now we will have two other guests who will be joining us to look at this topic. Now, the first guest we have is Cute Kaye. Now, speaking for him, the cute is spelled with a Q, but either ways it works. So we have Cute Kaye, the founder, Another Chance Foundation, and a former drug addict in Uganda. And also, thank you so much, Q, for joining us.
For having me. I'm really honored to be here.
Oh, it's a pleasure to have you. Thank you. Thank you. And also we have Othieno Shalom, an actress from Uganda as well. So thank you, Shalom, for joining us. All right, so we're yet to connect with Shalom, and once we do, we'll definitely bring her on board. But thank you once again, Q, for joining us. Now, let's go straight into it. I mean, we've seen the dire effect that drug abuse and substance abuse can have on the youth across Africa. What do we make of the statistics in Africa? Now, earlier on, I mentioned that about 70 or 60% of youth in Africa are either involved in drugs or addicted to drugs. What do we make about the statistics?
Well,
can you hear me? Okay.
Of course, the statistics are right. They are very right. One, because in Africa, for example, when I was addicted, when I got addicted, I didn't know the word addiction actually. In my vocabulary, I had been to school, but I didn't know what it meant to be addicted. So in Africa, especially here in my country, people don't know about it. They don't know what addiction is. It is something that nobody knows about. So it happens when nobody's aware. Nobody's aware that it's happening. And even the people that it's happening to, they don't know what's happening to them. They think it's just a habit, something, I just smoke a little bit, or I just sniff a little bit. So they don't know. And of course, what do you do about something that you don't know? It just keeps growing on you. So I think it's going to keep growing more and more and more and more and more, unless we get more advocates, people who can teach our society that it is happening, it is a mental illness, it is here as well in our backyard, and something should be done. Because here, I think it's affecting mostly the youth. Of course, other age groups too, but the youth especially. And what I always talk about when I go for an interview with TV is because I devoted my life next to making sure that everybody knows there is a disease, first of all, called addiction, because that way it gets easier for us to find ways to deal with it. So, yes, it is very, very rampant, and I think it's still growing, but simply because people are not aware of it. People are not aware of it. They don't know about it. We used to think it's something from the West, something from the white people, not something ours. not something that affects us too. But well, right now it's here. But the challenge is the people who traffic it in here, people who sell it to kids in schools and everywhere, they're here and they're working very hard. But then we, the people who are supposed to sensitize the public so that they're aware of it, you know, it's easy for children to make better choices if those choices are informed. That is, if we tell them what's happening. There is this drug, if you use it once, twice, you get addicted. There is crack cocaine, there is heroin, there is amphetamine, there is, you know, ecstasy, all those drugs that are now here introduced to people. We need to tell them about these drugs so that when they see them, they are aware. It's easier to fight them rather than not knowing and then being stuck in addiction.
Okay. I mean, all right. We also have Othieno Shalom, the actress from Uganda. But before we go to her, Cute, I would still like to ask this question. Now, a lot of youths think that, you know, there's a phase where the youths believe that that phase is just for exploring, you know, find out things, you just have fun and enjoy yourself. So a lot of people know that there are dangers associated with this, but they just want to explore. They want to try things out by themselves and get to know what it feels like. So I'm going to ask you now, as someone who has experienced this and thankfully have come out of it. Now, how deep can you say it gets, and how difficult is it to get out of once you start? Because a lot of people don't understand how difficult it can be to get out of once you get into it. Like you said, you didn't know what addiction is. Even if you went to school, you didn't know how the impact of addiction until you experienced it. So how deep can this get, and how hard is it to get out of?
I still tell people, I think, to me, ever since I've been alive, ever since I was born, the hardest time that I've been through in my whole entire life was the time of my addiction. Because, well, if you tried and checked out my story, it was so bad. It was really, really bad. Sometimes I tell people that I died and just, you know, God forgave me and I rose again. It is that deep. Once you use those A-class drugs, these guys who say that they want to experience, well, you can try it, that's fine. But once you use it once, twice, thrice, you get addicted. And once you get this disease called addiction, you need the drug to survive. It becomes your new normal. And when this becomes your new normal, that means without it, you get sick. You get what they call withdrawal symptoms or cold turkeys. So you will do any and everything to get it. You will lie to your mother. You will steal from your father. You will steal from your sister. You will do any and everything to get this drug. You will sleep on the street. It will take away everything that you hold dear to you. Believe me, that's what it does. And it's next to impossible to get out of it. Well, I think I'm one of the lucky few. But most times when you get addicted, very many people, by the time they realize they're addicted, they've already got lasting damage to their brains. They cannot now be normal anymore. Others go crazy. Many die. Well, I cannot tell stories, but I will tell you a few stories of people who have died when addicted. It felt so terrible because now I knew about it. I told to their families, but they didn't do something about it. And then they come crying back. He died like this. She died like this. And I tell them, I told you guys we need to do something immediately. Because people don't take addiction for a disease. When someone gets sick, instead of rushing to take them to hospital, they start to think about sending them to prison. They start to think about beating them up. They hide them in a store behind the house somewhere, and they think they'll just forget about it. So it is very, very deep. Once you are addicted, you are sick. Of course, there is chance to survive. You can live again if you go to rehabilitation center. But then the chances are not so high that you will live through it. Because while we smoke, addiction, what it does is, while we smoke these drugs, the substances, they affect your organs, inner organs. They affect the hearts, of the muscles of your heart, your liver, your kidney. Well, they keep affecting you inside. So if they don't kill you physically when you touch something and then someone kills you, then they will kill you from the inside. One organ will just collapse and you die.
Right. Okay, thank you so much for that. I mean, I think that every youth needed to hear that. And if you did hear it, then you should know how dangerous it can be to get your hands into it. Don't start what you can't finish. But anyways, we also have our other guest, the actress all the way from Uganda. Thank you so much for joining us, Othieno Shalom. Can you hear me?
Yes, I can. Okay. I don't know if you can hear me.
Yes, I can hear you loud and clear. All right, Shalom, quickly, is there a looming disaster if these issues are not addressed? We've seen how dire the effects can be. We've seen how dangerous it can get if you play into that. So is there a looming disaster if these issues are not addressed?
There is a looming disaster. Yes, it's there. And actually, I think the bubble has already been burst. It's just waiting that, what can I say? The bubble is burst. Children are already sick. The thing is in school, kids are already affected. And the truth is, sensitization has not been done concerning this issue. Like, people are focusing on sexual education and LGBT, but this disease has crept in and is killing the young generation at a very fast rate. Most of the mad children we see today are drug addicts. Alcohol. They have alcoholism. I talk out of personal experience. Like it's the bubble is burst. Let me tell you. My brother started this thing in senior one. In Uganda, we have senior one. Like how can I call it? How do they call it that side? J something. But in Uganda, senior one, and a teacher commented on the report and told my parents, your son has started smoking. My parents ignored the red flag. And my mother thought maybe the teacher just hated this boy and changed the boy to a different school. Lo and behold, the thing crept in, and today he is down. So it's something that has been waiting to happen, and it has happened. It has already happened. You cannot say it's looming. It has already happened. Kids are dying. Kids are sick. So something has to happen. Something has to happen ASAP, soon. We need to do something about drug addiction.
Right. All right, thank you so much for that. And also, I'd like to ask you very quickly, if you were to prefer solutions, I mean, we all agree that something has to happen, something needs to be done. If you were to prefer solutions to both the government, the family, the society, what would it be in a few seconds?
First of all, with the government, I would love the government to censure the drugs that come into the country. These expensive drugs, the opium and all these depression drugs, kids can buy them off the counter in pharmacies. How sad is this? Like, you walk in a pharmacy and buy a drug that is going to kill you, but you're going to buy it cheaply in a pharmacy. So I would love the government to censure such drugs. Like, they should not make it easy for a layman to go and buy it. There should be questions. There should be a letter why you're buying such a drug, So governments should censure drugs coming into the country, one. Then also government should get into schools, primary schools. They should censure children. They should train children. They should talk to children starting from the age of 10. My brother started this thing at the age of 12. And today he's sick. Kidneys shut down, everything. He's on dialysis twice a week. So government needs to come in. They need to sensitize teachers about it. They should not ignore the red flags that they're seeing in children. Once you see a child is smoking, schools should come in, teachers should come in. I feel like government is lagging behind, and also parents should also wake up. Right. In Africa we have a saying that it takes a village to raise a child.
Very true.
But in today's generation, everybody minds their business. So even when you see my child smoking, you mind your business. But if we go back to the old setting of the whole village can raise your child, I think we shall get back to the normal setting. It will help us a lot.
All right.
Yeah, thank you.
All right, thank you so much for that, Shalom. Now back to you, Q's, very quickly. What would you say? What are the solutions you would, if you were to prefer a solution, what would it be?
Well, honestly, family is the first unit of society. So I'm convinced that it's more about the family. If parents can begin telling their children right now, every parent should take it as their responsibility to inform their child at home. Like I said earlier, when a child knows, they make an informed decision. Otherwise, addiction to me is like a net that if you throw and the fish gets hooked, there is nothing it can do. So when a child gets hooked, there is nothing they can do about it. Yet there is an option of them not getting hooked. I think it's not easy for government to start fighting whoever brings in the drugs and so on and so forth. But if we began like that and there is no business for them, then it gets less and less, first priority for them. They'll go into other businesses. So it begins at your home. If parents can begin telling their children at home, government, if possible, should sponsor people like me, like her. They've been talking. We go to schools and sensitize people. We've been doing that, of course, but we need support in order to do it more and more and more. So I believe the solution is sensitization. Sensitization, okay. If everybody can know, that's where it ends. Actually, briefly as well, I have a song, it's called Let It Go. If you can check it out, say, on YouTube, Kaye on YouTube, you will see it's the same thing, information that I'm trying to pass. So I hope somebody can find it and learn something and show it to your children at home. That's the only way I think we should.
Okay, thank you so much for that, Cute. And I would like to use this opportunity to thank both Cute and Shalom for their input on this very important topic. Thank you once again to both our guests for joining us.